Hello everyone, my name is Nala Barry and this is my informative speech. There are between an estimated 1.6 and 3.8 million sports-related concussions in the United States every year, leading the Centers for Disease Control to conclude that sports concussions in the United States have reached an epidemic level. According to research by the New York Times, at least 50 youth football players, high school age or younger, from 20 different states have died or sustained serious head injuries on the field since 1997. The topic of this informative speech is concussions in athletes. As an athletic training student, I have seen first-handedly how suddenly an athlete can receive trauma to the head and become subjected to a concussion. Learning how to identify concussion based on its signs and symptoms can help you keep a bad situation from getting worse. In this speech, I will identify what a concussion is, describe its signs and symptoms, and discuss how to treat and manage it in an athletic atmosphere. In a paper entitled Practice Parameter, published by the American Academy of Neurology, a concussion is defined as a trauma-induced alteration in mental status that may or may not involve loss of consciousness. When accompanied by clinical signs and symptoms, changes at the cellular level are commonly referred to as mild traumatic brain injury or concussion. Concussions often occur from forces applied directly or indirectly to the skull that result in the rapid acceleration and deceleration of the brain. Concussions occur in males and females of all ages and in all sports, but are most common in contact and collision activities such as football. Now that you know exactly what a concussion is, you can now learn how they are diagnosed in athletes based on their signs and symptoms. The signs and symptoms of a concussion can be subtle or may not even be immediately apparent. Symptoms can last for days, weeks, or even longer. Common symptoms after a concussive traumatic brain injury are headache, loss of memory, amnesia, and confusion. The amnesia, which may or may not follow loss of consciousness, usually involves the loss of memory of the event that caused the concussion. Other signs and symptoms of a concussion may include temporary loss of consciousness, dizziness or seeing stars, ringing in the ears, nausea, or vomiting. Some symptoms of a concussion may be immediate or delayed in onset by hours or days after the injury, such as concentration and memory complaints, irritability, or other personality changes, sensitivity to light and noise, or sleep disturbances. Now that you can identify what a concussion is based on its signs and symptoms, you can learn how to triage it in an athletic setting. Treatment of athletic concussions is crucial to the return to play process of the athlete. In a position statement published by the National Athletic Trainers Association, it is stressed that once an athlete has been diagnosed with a concussion, he or she should be removed from a sport and not allowed to return to physical activity until cleared by a physician or designate. In the article, Medical Therapies for Concussion, the author, W.P. Meehan, suggests that during the substance stage of recovery, a physician may prescribe medications to reduce specific symptoms, such as headache, sleep disturbances, or anxiety, or to improve symptom resolution. During the acute recovery period, the patient should be instructed to avoid physical activity, for example, workouts or conditioning, and limit cognitive activity, such as academic work or computer use, so as not to exacerbate concussion symptoms. Once an athlete reports that they no longer have symptoms, the return to play progression can begin. Stage 1 consists of no activity. Stage 2 consists of limited light exercise. Stage 3 consists of sport-specific activities without the threat of contact from others. Stage 4, non-contact training involving others or resistance training. Stage 5, unrestricted training. And Stage 6 marks the return to play. Each stage should be separated by at least 24 hours. Throughout the course of this speech, you are made aware of how a concussion presents itself in athletes, how to identify it as per its signs and symptoms, and how it is treated and managed in an athletic setting. As you have learned, concussions are very serious medical injuries and can be life-threatening if not handled in the appropriate manner. The professionals who handle athletes are at risk for getting concussions assume great responsibility when they take on their positions. If handled correctly, athletes can return to play in no time.